Duchenne's muscular dystrophy has what inheritance type? A. X-linked dominant. B. Autosomal dominant. C. X-linked recessive. D. Autosomal recessive. The answer is C. X-linked recessive. Duchenne's muscular dystrophy is an X-linked recessive disease. Because of this, it is almost exclusively seen in males and rarely present in females. Girls would have to receive a recessive gene on both the X chromosome from their mother and their father. Historically, boys with a defective gene on their X chromosome rarely lived past their teens, decreasing the likelihood of reproduction. What antibodies are present in 90% of patients presenting with myasthenia gravis? A. Antibodies to acetylcholinesterase receptor. B. Antibodies to acetylcholine receptors. C. Anti-dsDNA, double-stranded DNA, antibodies. D. Anti-Oro antibodies. The answer is B. Antibodies to acetylcholine receptors. Myasthenia gravis is a condition in which the immune system makes antibodies to acetylcholine receptors, thus blocking receptors and preventing the stimulating effect of acetylcholine at the neuromuscular junction. This results in muscle weakness that progresses during activity and improves with rest. Anti-Oro antibodies are commonly seen in Sjogren's syndrome and systemic lupus erythematosus, SLE, and anti-dsDNA antibodies are highly specific for SLE. What condition is characterized by a deficiency of normal type 1 collagen, resulting in the formation of brittle, fragile bones? A. Marfan syndrome. B. Osteogenesis imperfecta. C. Legg-Calvé syndrome. D. Ehlers-Danlos syndrome. The answer is B. Osteogenesis imperfecta. Osteogenesis imperfecta is a genetic condition characterized by a deficiency of normal type 1 collagen, resulting in the formation of brittle, fragile bones. Bones fracture easily, often with no obvious trauma. Osteogenesis imperfecta has many subcategories that range in severity, several of which are not compatible with life. Ehlers-Danlos syndrome is a collagen abnormality that primarily affects the skin, joints, and vasculature, causing lax joints and general instability. Marfan syndrome is also a condition of connective tissue abnormality, which largely affects the structure and function of smooth muscle in the cardiovascular system. Legg-Calvé syndrome is a condition of necrosis in the femoral head, not related to any alterations in collagen formation. The rehab nurse provides care to an immobilized patient. He bears weight down on the patient's leg while the patient attempts to lift that leg. What type of exercise is this? A. Active assistive range of motion. B. Isometric. C. Active range of motion. D. Active resistive range of motion. E. Passive range of motion. The answer is D. Active resistive range of motion. Active resistive range of motion is performed by the client against resistance, manual or mechanical. This exercise builds muscle strength. Isometric exercises are performed by the client without motion, rather, the client contracts and relaxes the muscle without moving the joint. This maintains strength in the muscle while the joint is immobilized. Passive range of motion is performed by the nurse without assistance from the client, which retains circulation and range of motion in the joint. Active range of motion is performed by the client without assistance of the nurse and maintains joint mobility and muscle strength. Active assistive range of motion is performed by the client with help of the nurse to increase motion in the joint. In the emergency department, the nurse evaluates a patient with severe pain in the left calf after falling during a soccer game. Which of the following is the most appropriate action by the nurse? A. X-ray the calf. B. Give morphine. C. Apply heat to the calf. D. Notify the physician. E. Bandage the calf. The answer is A. X-ray the calf. The nurse should begin assessment to determine the cause of the complaint. Obtaining an X-ray for the leg is the best assessment. You need to rule out possible fracture before giving pain medication or bandaging the leg. Heat is inappropriate for this injury because ice is best for sports injuries such as sprains and breaks. Notifying the physician may be done after all assessments are completed.